Yes, a pharmacist can not just question the prescription written by the doctor, but can also void or refuse to fill the prescription, meaning if in the professional judgment of the pharmacist, the prescribed medication may harm the patient, such as when the patient is allergic to the medication, or the medication may just adversely interact with other medications that the patient is taking, or in the pharmacist's professional judgment, the dose of the medication prescribed is not safe for the patient. You know, when we refuse a prescription, we actually have to refuse it on good faith, and we actually make notes and reasoning of why we are refusing it. And it's not like we are just refusing it completely. What we basically do is we contact the doctor and kind of come on a common ground of a prescription and get the right dosage, which both of us, like the doctor and pharmacist, think that is safe for the patient. And you know, in US, you will often see that happening. A pharmacist will question a prescription written by the doctor, and this is actually how we catch errors and save patients' life. This is why I feel it's so important that the Pakistan government strictly implement the correct pharmacy setup in Pakistan as well, because literally the graphs of deaths related to medication errors is going higher and higher every day in Pakistan. And actually, I was reading an article the other day, and according to a research, nearly 500,000 people die every year in Pakistan just because of medication errors. And that's no joke. That's not minor. That really calls for a change. You know, we, meaning pharmacists, have spent 5 years in the pharmacy school studying all about the medications. We are basically experts in medication, and that's why we catch so many medication errors. For example, I personally have contacted the doctor's office so many times suggesting the correct medication dosing, a frequency, or maybe pointed out an interaction. Now, that being said, I'm not saying that the pharmacists in any way are better or are more knowledgeable than doctors. See, being an expert in medicine, we're just playing our part and teaming up with the doctors to provide a better care for the patient. And I feel this professional bond between doctors and pharmacists lacks in Pakistan and many other countries. And actually here we have this great bond with the doctors, and most likely 99.999% times the doctors have been so cooperative as well. You know, they are actually really appreciative when we give our opinion on patients' medication or like sometimes help catch error. But rarely I would say, 1 in 100 doctors may show a tantrum and be like, I'm the one who prescribed the medication in a certain way. Who are you to change it and blah, blah, blah. Well, whoa, easy, doctor, easy. Well, what do you think happens in that case? You know, I personally think it's not a fight of representing yourself or showing who's better. You know, we are all providing a mutual care. We are all there for the patient. But you know, still things like that happen. But here's the good thing that I really like in US, that the state and federal laws are not just made to get us. At least that's how some people think. Well, don't look at me like you think I feel that way. Because I feel that laws are made to protect us. They've got our back, and they support our professional and good faith judgment when we are in a situation like that. And honestly, I've been in such a situation many times when not just doctors, but even patients argue, and they don't like it when I question a doctor's prescription. And I say that, okay, I'm gonna refuse it because I think it's not safe for you. And every once in a while, the doctor or patient be like, well, who are you to question it? You're no doctor, you didn't write the prescription. Well, to that, my answer is that doctor may or can write the prescription, but as a pharmacist, I'm the one dispensing it. I'm the one dispensing it under my license, under my name. And if in my professional judgment, the prescription is not fit for the patient, then the law gives me right to refuse the prescription or at least get it adjusted by the doctor. Because let's say, God forbid, if something happens to the patient, I am the one liable for it because I'm the one who dispensed the medication, and I was the last resort who could have stopped the medication from going into patient's possession and like save the patient, right? So yeah, I have the right to question it, and it is my job to make due diligence and make sure that whatever I am dispensing is safe for the patient. It's not gonna harm the patient. And you know, this is how important and crucial the role of pharmacist is. We can not only save the patients from medication errors and like kind of ensure patient safety. In fact, the pharmacist can help reduce the cost of the medication and improve the patient medication adherence. And you know what? A lot of insurances like Medicare have started to recognize that. And now pharmacists are actually playing a key role in medication therapy management, which is MTM, and patient adherence. We actually follow up with the patient about the medication outcomes. We follow up with them about the side effect. We make sure that the patient adheres to the medication. If the patient needs any certain preventive therapy like a statin to prevent a heart attack, we're also acting as like diabetes management. We're managing their blood pressures. Not only that, we are even now providing vaccinations. We are prescribing contraceptives. We are prescribing like an opioid reversal medication like Narcan, travel immunization, and much more. We as a pharmacist in today's era can do way more than what people actually think. And you know what I mean by that? People think we are there behind the counter with this white jacket on and just counting pills. No, we are not just counting pills. We are actually dispensing the medication in a way that when it gets to you, it doesn't hurt you. Oh my gosh, I'm sorry. I think I really got a little emotional talking about that. Even my mouth is dry now, so let me take a sip of my coffee. But you know what? Actually, I really hope that Pakistan government takes steps and make changes in the healthcare system and kind of try to effectively use pharmacists, because they will not only improve the patient's health, but they'll also reduce the medical cost. Because you know what, honestly, right now in Pakistan, the pharmacies are being run by non-professionally trained drug sellers who are actually just dispensing each and everything without a prescription. Even antibiotics go out without a prescription, and guess what? The community is building resistance to these antibiotics. Pharmacies are run in the absence of pharmacists. I was actually in Pakistan just earlier this year, and I was completely surprised to see that, because if this happens here in US, they will not only, the board will not only just seal the pharmacy, but also revoke the pharmacist license who's been trying to run this back and show or something. Please don't do it, because it's not safe for the patients. You know, pharmacists in Pakistan, please, like, just have value in your license. Stop leasing your license to these medical stores who are just using your license and selling these medications out to public without even making sure that they are safe for the patients. Anyways, that concludes my today's video. Well, now that you know what a pharmacist is capable of doing, do reach out to your pharmacist next time you self-medicate yourself, your child, or a family member. And just check with your pharmacist before giving the medication to be sure that it's safe for the person. And finally, I'd like to say that through this video, I'm actually representing not just myself, but thousands and millions of unheard voices of pharmacists in Pakistan who really wish for this change. And they want to be recognized as an important role in the healthcare system. So please, please, please share this video as much as you can and help us reach the right person and right health authority and be a part of the change. Hey guys, thank you so much for making it till the end of this video. Let me know in the comments what you think of today's topic, and subscribe now to stay up to date on new videos on health and pharmacy. I will see you next time. Take care. Bye-bye.